Spotlight in Shortland Street.
Surveillance on one of our suspects. He's stalking a nurse.
Which suspect?
Cuff him. You have the right to remain silent. Anything you do say can be used as evidence against you.
What has he done?
It's just a misunderstanding. He hasn't done anything wrong.
Why is he even in our house?
Who are you?
This is my brother, Sunil.
I've seen you on the news. Is this about the murders?
We'll be in touch.
I was just visiting, that's all.
Save it. Well, make way, please.
It's okay, Shanti, just stay calm.
I'll come down as soon as I can.
You will do no such thing.
Well, I have to help him.
Why? Because he's your boyfriend? Answer me. Yes.
What are we celebrating?
PCC lives again, my darling.
You got the funding! Yay!
Well, for another year at least. And the Scottspear executives love me, so I think it's a long-term relationship.
Oh, is this a long-term relationship that I should be jealous of?
Not at all, because you are top of the invitation list.
Invitation to what?
Cocktail party tomorrow night. They want to acknowledge the little people who helped along the way.
Oh, I wouldn't miss it for the world. Ooh, who else is coming?
Well, there's Chris, of course. And I said they want to acknowledge the little people, so there's some suits. And TK, of course.
Tess Adamson.
Yes, she is the practice manager after all.
And Hunter.
Partners are invited.
Tell us you can't come, and suddenly I'm very busy.
Jessie, you are my wife. You have to be there.
And Hunter is your son, who you'll proudly introduce to all the Scottspear executives, right? And who Tess will proudly introduce as her bit on the side.
Look, I will talk to her and she will be discreet.
No! Put your foot down. Tell her she's not wanted.
What, and drive Hunter even further away? Nah, it's not going to happen, Jessie.
I am not a hypocrite. I'm not going to stand there and smile and pretend that everything's all right when it's not.
Look, those two are back together again. There is nothing we can do about that. Maybe it's time we accepted that, all right? Jessie, I miss my son.
So do I. But I'm not going to give them the green light. Not now, not ever. You were sitting outside Shanti Kumari's house for 30 minutes.
I was waiting until her brother left.
Nothing suspicious about that.
He doesn't want me to see Shanti. Neither do the rest of the family.
Because you're dangerous.
Because I'm not their type, I suppose.
What did you do that upset them so much?
Nothing. It's a cultural thing.
So you and Shanti have to sneak around? Have secret dates?
We keep things quiet, yes.
How convenient.
Excuse me?
If Shanti were to suddenly go missing, her family wouldn't know who to blame.
Don't respond to that.
You're losing it, Lara. Seeing killers everywhere. Maybe it's time you called in your bosses, or are you the best they've got? I don't have to answer any more questions, do I?
Not unless the police have any real evidence to present.
Not yet.
Good.
I said not yet. I have a warrant to carry out an extensive forensic search on your property and vehicle.
Can she do that?
My officers are already en route. It's a time-consuming process, one that can't be rushed. We'll need you to remain in custody until the search is complete. I'm just saying that some good publicity would make a nice change.
Hugh doesn't want the surgery going public. He's worried his share prices will fall. Have the call started?
I've told Yvonne and Gerald to say no comment until you say otherwise.
Good.
Come on, Chris. The hospital really needs this.
What do we need?
It's okay. You can trust Libby.
In that case, if you were Joe Public, how would you feel if the famous Chris Warner was to operate on the famous Hugh Carter?
The billionaire software developer Hugh Carter.
I rest my case.
Of course the public would be interested. Of course it'd be good press. But Hugh doesn't want a fuss.
In my book, groundbreaking surgery is a fuss.
Can I ask what's wrong with him from a Joe Public point of view, of course?
Mr. Carter had advanced cancer of the larynx. I performed a total laryngectomy on him 6 months ago. Although there are handheld electronic devices he could use to help him communicate, he'd rather have his voice.
You're going to make him speak again.
See?
This is how we want people to see Shortland Street, as a cutting-edge hospital performing miracles, not harbouring a murderer. You're changing the man's life, Chris. One photo opportunity is a very small thing to ask in return.
If it were up to me, I would say yes, but there's this small thing called patient confidentiality. That's all he's asking. That's all I'm doing.
Oh, but...
End of discussion.
I was planning on washing my hair tonight.
Look,
You did see the bit where it says open bar.
And you saw the bit where it says Tess Adamson and partner.
Will Hunter be washing his hair too? Come on, you work in the PCC. You have to be there, Tess, all right?
People who need my attention.
Kia ora, Shortland Street Hospital.
Oh, sorry.
We don't have
okay.
any comment. Sorry. You can ask as many questions as you like, but I can't...
Got my signs out, I'm mopping backwards and forwards like the manual says.
Looks like you're finally taking this seriously.
Don't have
No
any...
circular motions, I'm a genius.
Don't get smart. Look out.
Whoa, what happened to him?
It's not our job. Get back to your mopping act. You get used to it.
Don't mind me.
What are you doing in here?
Neville told me to mop the floor.
We'll come back later. We can move you to a private room now to say your goodbyes.
Thank you.
I'll see you afterwards. Shanti, Mr. Carter's on his way to theatre. He's going to be in HDU for a few days and then he wants to be transferred to Trinity Private. Can you sort that out?
Sorry, what was the name?
Hugh Carter. He's having the laryngeal surgery.
Of course, I've already organised that.
You all right?
I'll be fine, thank you.
You're not going to impress the boss like that, are you?
I was just taking a breather. Been working hard all morning.
You can't stick at anything, can you?
I'm trying, but all the blood, the guts, the sick people, it's too much.
It's a hospital, mate. What do you expect?
Didn't think it'd get me sick. Give me a disease.
You'll get used to it.
Well, everybody keeps saying that. But how can you get used to seeing people with their guts hanging out? People coming straight from an accident?
Not knowing whether they're going to live or die. Like, you're not alone. It was the same for me when I started. It's scary.
So why didn't you just give up?
Because some people come straight from an accident and they live. Because of what we do here, and that's why we all keep going.
Yeah, well, you guys are neat. Me, I just mop the floor.
And if you didn't mop the floor, the place would be a pigsty and it'll be shut down within a week. Look, come on, you gotta stop looking at the blood and guts and start looking at the good things, you know? New friends, skills, payday.
Yeah, thanks.
No worries. And if you come down and empty my rubbish bin as soon as you can, kia ora.
Whoa. Is this where they cut people open?
Don't mind the newbie.
Hey, Danny.
Hey. Oh, gross.
You big girl's blouse.
You'll get used to it.
I just wasn't expecting it.
Oh, you ain't seen nothing yet. Pretty, eh? Are you okay? Maybe you should sit down.
Uncle, did he die?
Oh, no. Patient's fine. He's in recovery now.
Right, listen up. Fill your bucket with the bleach solution. Mop the floor line for line. I don't want you going all over the show, okay? Then you use the wipes to clean the surfaces that cannot be mopped. We're getting rid of all the blood and bacteria so patients don't pick up infections.
What about us picking up infections and all that?
Welcome to our world.
How'd it go?
Not bad.
Can Mr. Carter speak?
He's still intubated. It'll take a while for his voice to kick in again.
But you're confident of a full recovery?
I am.
I bet I know the first words he's going to say. You are a god.
Yeah, just a thanks, mate, will do me.
Well, what better way to say thanks than a much-needed, positive, glowing press conference?
Libby.
I know if I just got my voice back, I'd want to shout it to the world.
He's asked for privacy.
But everyone should know how brilliant you are. I mean, it's the kind of thing people would want to know. An antidote to all the gloom and doom in the papers.
It's a nice sentiment, Libby, but I have to respect the wishes of my patient.
The editor, please. Tell him it's about Shortland Street Hospital.
You look like you've done enough study today.
I have.
Well, then you deserve a night out. Movies?
No, I'd rather go to this.
I was thinking about giving it a miss.
You're a guest of honour.
Cocktail party is code for schmooze with booze. That's all it is. And I'd rather be with you.
What did Dad say to you? Did he tell you not to come?
No.
Don't cover up for him, Tess. If he's still hassling you, I need to...
No, he was actually really nice. He said we were welcome. Both of us.
Really?
Really. But it's not your father I'm worried about.
Mum will be fine.
No, she won't. And if I were her, I'd probably feel the same way.
Think of this cocktail party as Switzerland. Neutral territory. A chance to broker peace.
Well, that study has affected your brain.
This is a really important work function, Tess. She won't be able to lose the plot. She'll have to be civil, polite. And while she's doing that, she can't help but see us together and happy.
Switzerland, you think?
Mm-hmm.
Dr. Warner!
I have no comment on any recent
What about
arrest.
the Hugh Carter surgery?
How did you...
Was it a success? Why did he choose you?
Can he speak yet? Google Hugh Carter and it will come up, and then go straight to the newspaper site. I'll just get Gerald to do it, Mum.
Once again, my apologies.
Gotta go, bye.
Okay, we'll talk soon. Get me Justine now.
If it's about the leak, I've already paged her.
You know about the leak?
It's online.
What?
Just listen. A spokesperson for Mr. Carter said he chose Shortland Street Hospital because CEO and surgeon, Dr. Chris Warner, had successfully performed a similar operation in the United States.
Well, let me see that.
Blah, 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 re the murders. Despite the pressure his hospital is clearly under, Dr. Warner took on the difficult surgery, proving he is a true leader.
Okay, that's enough.
No harm done, right?
This is unauthorized. I can't just let something like this go.
Why not? Mr. Carter's people are happy. His shares are holding. You get the credit you deserve, and everyone around here gets a much-needed boost.
Libby Jeffries, what do you know?
I know nothing.
If, hypothetically, you knew the person who leaked this...
Which I'm neither confirming or denying.
Tell them that their head is safe for now. But if it ever happens again...
I'll pass that on, hypothetically.
$20, says it, Scotty.
Gerald?
What? It's what everyone's saying.
It's the army. It sends some guys right over the edge. They get conditioned to killing and can't stop themselves.
That's funny. Weren't you a suspect 2 minutes ago?
Yeah, I put $10 either way on Gavin as well.
Shut up.
Oh, hi, Shanti. How are you doing?
I'm getting there.
Oh, this place is such a dump. Why don't people just learn to tidy up after themselves?
I have to get back to work.
Yeah, me too.
I feel like I've got the plague. Everywhere I go, people seem to run in the opposite direction. It's not like I haven't seen it already. I have to ask, was it Scotty who got arrested? It's a big misunderstanding. He hasn't done anything wrong. They've printed a bunch of lies and everyone believes them. No, not you too.
I'm sorry, but it's hard to be certain about anyone right now.
It's just Scotty, you know him.
Not very well. And he hasn't made an effort to get to know anyone apart from you.
But you can tell he's a good person just from working with
All I know is that I am sick of being scared. I just want them to catch the psycho, whoever he is.
It's not Scotty.
Whatever, Shanti, the cops will sort it out.
I think Lara has something against him.
Maybe she has good reason.
How can you say that? She badgered Mark for ages and he had nothing to do with the murder.
But it didn't take her long to figure out he was lying his butt off about a whole lot of other things. Things I couldn't even see, and I was married to the guy. Babe, I'm sorry. I don't want to upset you. Just take care, eh?